Good morning. Myself, Dr. Abhay Betala, Professor in Department of Forensic Medicine and Toxicology from SLIMS, Pondicherry, Bharat Institute of Higher Sciences. So, before going to the PPT presentation, I would like to know the students that a reader lives 1,000 lives before he dies. This is just a mnemonic which helps for the students to understand the importance of books. Now we will come to the topic proper, that is known to be as thanatology. It's a Latin terminology which deals thanatos and logos. Thanatos is death and logos is the course or study. So thanatology deals with death in all its aspects. There is a progression from clinical death to brain death, biological death and cellular death. Brain death follows immediately. Clinical death due to lack of oxygen. First, the cerebral cortex, then cerebellum, and then lower brain centers die. Ultimately, the brain stem and the vital centers die. Thereafter, the processes of cellular death begins. As per section 46 Indian Penal Code, death denotes death of a human being unless the contrary appears from the context. Coming to Registration of Births and Death Act, section 2B defines death as a permanent disappearance of all evidence of life at any time after live birth has taken place. I repeat, death is defined under section 2B of Registration of Births and Death Act as permanent disappearance of all evidence of life at any time after live birth has taken place. There are two important types of death. They are somatic death and molecular death. Somatic death is also called as systemic or clinical death. What is somatic death? It is the complete and irreversible stoppage of circulation, respiration, and brain functions. That is Bishop's tripod of life, but there is no legal definition of death. Organ transplantation. There are various organs in our body which can be transplanted for treatment of a person who is in need of organs. The success of homograft mainly depends on the type of tissue involved and the rapidity of its removal after circulation has stopped in the donor. Cornea can be removed from the dead body within 6 hours. Skin in 24 hours, bone into 48 hours, and blood vessels within 72 hours for transplantation. Other organs like kidney, heart, lungs, pancreas, intestines, and liver must be obtained soon after circulation has stopped as they deteriorate rapidly. The body does not reject a transplanted cornea. Cornea donors range in age from newborn to 70 years or older. Most bone transplant last the life of the individual. Moment of death. One should know that death is not a process. It is not an event. It is a process. Does not occur at a single time. It takes a process. Historically, medically and legally, the concept of death was that of heart and respiration death. That is spontaneous stoppage of heart and lung functions. Heart-lung bypass machines, mechanical respirators, and other devices. However, the new concept, that is irreversible loss of cerebral function, defines death, which is a moment of death. Brain death. There are three important types of brain death. They are cortical or cerebral death, brainstem death, and whole brain death. Brainstem death. It's very important to know that, because here the cerebrum is intact, though the functionally by the stem, that is a brainstem lesion. The tissue in the floor of the aqueduct between third and fourth ventricles of the brain contains ascending reticular activating system, that is ARAS, which extends throughout the brainstem. If the brainstem is damaged due to trauma, cerebral edema, hemorrhage, hypoxia, or infection such as poliomyelitis, respiratory motor system fails, and have damage to the ascending reticular activating system, that is ARS, causes permanent loss of consciousness, and higher centers in the cortex are also irreversibly damaged, causing whole brain death. Criteria for the brain death. There are two important criteria. One is a Harvard criteria for determining brainstem death, and there is another, that is Philadelphia criteria. We will discuss one by one. Harvard criteria of determining brainstem death. First, there is unreceptivity and unresponsivity. Second, there is no movements. Third, apnea, there is complete stoppage of respiration. Fourth, absence of elicitable reflexes. Fifth, irreversible coma. Sixth, isoelectric EEG, that is encephalogram, electroencephalogram. Coming to molecular death, it means the death of a cells and tissue individually, which takes place usually 1 or 2 hours after the stoppage of vital functions. Molecular death occurs in piecemeal, like in individual cells will live on their residual oxygen for a variable time after their circulation has stopped, depending upon the metabolic activity of the cell. The subsequent changes occur due to metabolic dysfunction and later from structural disintegration. Nervous tissue die rapidly. The vital centers of the brain in about 5 minutes, but the muscle live up to 1 to 2 hours. Next, let us see about asphyxia. Asphyxia is a condition caused by interference with respiration or due to lack of oxygen in respired air, due to which the organs and tissues are deprived of oxygen, causing unconsciousness or death. The brain weight is about 1.4% of the body weight, but uses 20% of the total available oxygen in the body. Types of asphyxia. The causes, like mechanical, pathological, toxic, environmental, traumatic, postural asphyxia, iatrogenic. According to Gordon, anoxia, that is the stoppage of vital functions, depends on tissue anoxia. Anoxia means entire or complete loss of oxygen. There are four important types of anoxia. Those are anoxic anoxia, anemic anoxia, stagnant anoxia, and histotoxic anoxia. Coming on to modes of death. According to Bychat, there are three modes of death, depending on whether death begins in one or others of three systems, irrespective of what the remote causes of death may be. The modes may be asphyxia that we have just learned, other being coma and syncope. Now coming to asphyxial stigmata. Three important stigma are those like petechial hemorrhages, that is a pinpoint about zero point 0.2 millimeter of hemorrhages over the skin are seen. Other being the congestion, and third is a cyanosis. Coma, a state of unarousable unconsciousness determined by the absence of psychologically understandable responses to external stimuli or inner need. It involves the central portion of the brainstem. Coma is a clinical symptom and not a cause of death. The causes of coma includes compression of the brain, drugs, metabolic disorders, others like thromboembolism or epilepsy and so forth. Syncope. Syncope is a sudden stoppage of the action of the heart, which may prove fatal. For example, the syncope synonym is fainting, a fainting attack. Causes of syncope includes anemia, asthenia, that is weakness, muscular weakness. Third is a vagal inhibition, and fourth is exhausting diseases. Coming on to causes of death, that is as per MCCD, that is medical certification into cause of death. There are three important causes of death, that is immediate cause, basic cause, and third is a contributory cause. Determination of the cause of death following autopsy is an interpretive and intelligent procedure and depends on sound evaluation of all data, circumstances surrounding the death, morphological evidence of death, diseases and injury, and additional laboratory investigations. Manner of death, the circumstances under which the person died, the pathological diseases, that is, a natural diseases like myocardial infarction, pneumonia, meningitis, poliomyelitis, so on and so forth. Some unnatural causes of death, accidents, suicide, homicide, undetermined and unexplained origin. Coming on to mechanism of death, one should note that manners of death, mode of death, cause of death, mechanism of death, all are different. So coming on to mechanism of death, it is a psychological or biochemical disturbance, for example, shock, sepsis, toxemia, severe metabolic acidosis, and alkalosis, ventricular fibrillation, respiratory paralysis, etc. Agonal period, that is, the time between the lethal occurrence and death. Negative autopsy. What is this negative autopsy? Autopsy is nothing but post-mortem examination after birth, death. When gross and microscopic examination, toxicological analysis, and laboratory investigations fail to reveal a cause of death, the autopsy is considered to be negative. About all autopsies, 2 to 5% are negative autopsies. Causes of negative autopsy are like this: inadequate history, inadequate examination, inadequate or improper external or internal examination during autopsy, insufficient laboratory examination in forensic science laboratory, lack of toxicological analysis, lack of training of a doctor. Obscure autopsy is the another one, which is they do not show a definite cause of death in which there are minimal, indefinite or obscure findings or even no positive findings at all. They are sources of confusion to any pathologist. Frequently, these deaths are due to obscure natural causes, but they may be due to certain types of injury or complication of injury or poisoning. Mild degrees of natural diseases should be should not be implicated unless other possibilities are most carefully eliminated. Natural diseases like pathological diseases like myocardial infarction, pneumonia, meningitis, peritonitis, so forth. Biochemical disturbances like acid-base imbalances, endocrine dysfunctions like in diabetes insipidus, hypothyroidism, so and so forth. Concealed trauma, like especially in axilla, mouth, eyes, ears, so forth. Poisoning, various poisons, organophosphorus poisoning, lead poisoning, corrosive poisoning, so many poisons are there which can lead to death. Miscellaneous, like allergy, drug idiosyncrasy, sudden death. Here, the causes of death is sudden or unexpected when a person not known to have been suffering from the dangerous disease or injury or poisoning is found dead or dies within 24 hours after death, after the onset of the terminal illness. I repeat, death is said to be sudden or unexpected when a person not known to have been suffering from any dangerous disease or injuries or poisoning is found dead or dies within 24 hours after the onset of terminal illness. This is very important, after within 24 hours after the onset of terminal illness. Some authors limit sudden death as those occurring instantaneously or within 1 hour of the onset of symptoms. Causes of sudden death includes diseases of cardiovascular system, which is most important, and it occurs about 45 to 50%. The most commonest cause of cardiovascular system death includes coronary atherosclerosis or coronary artery disease. Second is a coronary artery embolism. Then comes blockage of coronary ostia, arterial hypertension with atherosclerosis, rupture of fresh myocardial infarct. Sixth, spontaneous rupture of aorta. Seventh, angina pectoris, myocardial infarction, etc. So these are the various important diseases of cardiovascular system causing the sudden death. Coming to respiratory diseases which causes sudden death includes 1. Lobar pneumonia, 2. Bronchitis and bronchopneumonia, 3. Pulmonary tuberculosis with cavitation, 4. Pulmonary embolism and infarction, 5th. Air embolism, 6th. Influenza, diphtheria, acute epiglottitis, 7th. Acute edema of the lungs, 8th. Lung abscesses, collapse, pleural effusions, etc. Central nervous system disorder like cerebral hemorrhage can cause sudden death. Cerebral hemorrhage pontine hemorrhage, subarachnoid hemorrhage, cerebral thrombosis and embolism, carotid artery thrombosis, brain abscesses, brain tumor, meningitis, epilepsy, etc. are all the causes of sudden death in central nervous system disorder. Coming to genitourinary system, which is 2 to 5% of all the sudden deaths. They include chronic nephritis, nephrolithiasis, obstructive hydronephrosis and pyelonephrosis, tuberculosis of kidney, tumors of kidney or bladder, rupture of ectopic pregnancy, toxemia of pregnancy, uterine fibroids, uterine fibroid, ovarian cyst. Coming on to alimentary system, about 6% of gastrointestinal tract disorders can cause sudden death. Hemorrhage in the GIT from peptic ulcer, esophageal varices, or cancer of esophagus. Second, perforation of ulcers, which includes peptic, typhoid, amoebic, malignant perforation. Third, acute hemorrhagic pancreatitis. Fourth, strangulated hernia. 5. Twisting and intussusception of bowel. 6th, paralytic ileus, appendicitis, liver abscesses, rupture. 7. Intestinal obstruction, obstructive cholecystitis. Some miscellaneous causes, that is other 5 to 10% of the causes of death, sudden death are Addison's disease, diabetes mellitus, hemochromatosis, hyperthyroidism, blood dyskaryosis, cerebral malaria, shock due to emotional excitement, anaphylaxis, reflex vagal inhibition, mismatched blood transfusion. That's it. Thank you. Thank you very much.